What is Achilles tendonitis? Achilles tendonitis occurs when the tendon that connects the back of your leg to your heel becomes swollen and painful near the bottom of the foot. There are two large muscles in the calf. These create the power needed to push off with the foot or go up on the toes. The large Achilles tendon connects these muscles to the heel and allows you to push your foot down. You use your Achilles tendon when walking, running, and jumping. Tendinitis due to overuse is most common in younger people. It can occur in walkers, runners, or other athletes. Tendinitis from arthritis is more common in middle-aged and older adults. The symptoms of Achilles tendinitis include 1. Pain in the heel and along the length of the tendon when walking or running. 2. Pain and stiffness in the area in the morning. 3. Pain in the Achilles tendon when touched or moved. 4. Swelling and warmth in the heel or along the tendon. 5. Difficulty standing up on one toe. Diagnosis of Achilles tendonitis. Your healthcare provider will first perform a physical exam. Your doctor will look for tenderness along the tendon and pain in the area of the tendon when you stand on your toes. X-rays can help diagnose bone problems, and an MRI scan may be done if you are considering surgery or there is a chance that you have a tear in the Achilles tendon. Treatment at Penn. Achilles tendonitis can often be treated without surgery. Your healthcare team can recommend changes to your normal activity that will help with your symptoms. A physical therapist can also show you stretching exercises for the Achilles tendon. It is important to remember that it may take at least 2 to 3 months for the pain of Achilles tendonitis to go away. If your pain does not improve, you may need surgery to remove inflamed tissue and abnormal areas of the tendon. If there is a bone spur irritating the tendon, surgery can be used to remove the spur. 5 home remedies for Achilles tendonitis. Cold compresses. A cold compress helps reduce pain and swelling, two main symptoms of Achilles tendonitis. It will also help relax the affected muscles. Warm wraps or elastic bandages. You can use warm wraps or compressive, elastic bandages to reduce the amount of stress placed on the affected muscles. This in turn decreases swelling and pain as well as speeds up the healing process. 1. Massage. This is another good way to treat Achilles tendonitis. 1. A gentle massage will help increase circulation, relax the muscles, and reduce swelling and stiffness. 1. For massaging, you can use olive, coconut, sesame or mustard oil. 2. Castor oil. You can also try castor oil to ease the symptoms of Achilles tendonitis. 2. The oil is mainly comprised of ricinoleic acid, an anti-inflammatory agent. 2. Topically apply castor oil to the site of the pain 2 or 3 times a day. 2. This helps relieve pain and minimize inflammation of the tendon. 3. Vitamin E. Vitamin E is a fat-soluble antioxidant that helps relieve inflammation and pain by getting rid of free radicals that may be contributing to it. 3. Vitamin E also improves circulatory function, which reduces swelling and promotes healing. Prevention tips you can follow. If you're able to prevent an injury, it can save you a lot of time and hassle later on. At our facility, Dr. McAllister gives you different strategies and tips you can use to keep your legs in shape while avoiding getting hurt. The following are some things you can do to keep yourself pain-free. 1. Gradually get more active. Many times, Achilles tendonitis strikes when you amp up your workouts too quickly. You can avoid this complication by gradually getting into your workout routine, and slowly increasing the duration. 2. Rest when needed. Make sure you warm up before participating in especially strenuous exercise. You also want to take a break from activities that put a lot of stress on your Achilles tendon, such as running up steep inclines. If you feel pain or discomfort at any point in your exercise, make sure to stop and get rest. 3. Wear comfortable footwear. It may not seem like it, but the shoes you wear for exercise play a very important role in injury prevention. Make sure your shoes are first and foremost comfortable and supportive of the arch in your foot. They should also provide firm support to your heel to keep stress off the tendon. When your shoes get worn out, make sure you replace them. 4. Make stretching a priority. Stretching is important to your daily routine because it helps take the strain off of your muscles and tendons, and also increases flexibility. This is especially important before and after you exercise, to prevent the recurrence of Achilles tendonitis. 5. Switch up your workouts. Constantly doing the same type of high-impact workouts leads to overuse of the tendons and ultimately, injury. By switching up your high-impact workouts with lower-impact activities like swimming or biking, you'll put less stress on your legs and tendons. 6. Build up your calf muscles. Strengthening your leg muscles, especially in your calf, can take some of the stress off your Achilles tendon. This helps the muscles and tendons work together to take on the pressure of running, jumping, or climbing. At the end, it was requested you to please subscribe our channel.